Well, we all want the best prices when we shop, right? If you're looking for a computer, a new car, or just about anything else, it's pretty easy to find the price range after a quick web search. But for healthcare, forget it. It's well known to health policy types, but less so to consumers, that the healthcare marketplace lacks transparency when it comes to cost. It's hard to know whether you're getting a fair price or paying through the nose for a procedure like a mammogram or an MRI. KQED is stepping into this void with a new project called Price Check. Scott Shafer talked earlier with Lisa Aliferis, editor for KQED's State of Health blog.
So Lisa Aliferis, what's the deal with the healthcare market? Is it just fundamentally different than other markets?
Pretty much. So it's virtually impossible for consumers to find out the price of something in advance of a treatment. You can call around. I mean, people have described calling a hospital. They're going to have some procedure and they get shuttled from place to place to place. Nobody can give them a straight answer. So
why is that? I mean, is it there's just a lack of transparency built into the system somehow?
It's a lot of it is the way traditionally that healthcare has been covered in this country. Originally, we had an indemnity insurance plan system.
What does that mean?
So that means that you would pay, as the consumer, you would pay 20% of whatever was charged. So then there would be an incentive to have a higher and higher charge because insurers would pay 80% of that and you would pay 20%. Then we've had this transition to HMOs, but in the meantime, insurers negotiate directly with employers. Employers don't get to know what insurers are negotiating with providers, what those costs are. So it's really an opaque marketplace.
So that raises a good question. If someone is paying out of pocket for, say, a mammogram, they're going to have a different price than, say, someone who went through Kaiser and may not even have seen a bill, right?
That is correct. So that's the other. Kaiser is a closed system. People in general pay a premium and all their care is covered. Someone else may get their explanation of benefits. If you're insured, you've probably seen these forms, a description of what your insurer covered. You look at the form and there are probably numbers all over it that are a little hard to decipher until you really sit down and pay close attention to it. And yes, self-pay prices are different and often the highest price that might be paid.
And so lack of transparency, Price Check is aiming what? To break through that?
So we've launched this new project, Price Check. So it's KQED in collaboration with KPCC. They're our NPR affiliate in the Los Angeles area, and a New York City startup, Clear Health Costs. And so what we're doing all together is sampling prices on a very narrow number of procedures across California. We've both called, Clear Health Costs has called in the Bay Area and in the Los Angeles area to get these cash or self-pay prices for mammograms at a handful of places, a handful of imaging centers or hospitals. And we're asking people to submit what they themselves have paid because we want to see the range of prices charged and paid around the Bay Area and statewide.
And give us a sense, what are you hearing, what are you seeing so far in terms of the range of price for a mammogram? So
it's very early, but initially, just as we started, we had these self-pay prices. Now those ranged from, in the Bay Area now, from $125 at one imaging center all the way up to $801. Now in the interim, we've had women submit some of their bills of what they've paid. And one woman reported that she was charged $1,500. Her insurer paid $1,200. She paid $300. Now, we're a little confused by this, and this gets into the crowdsourced nature of the data, because screening mammograms, that is to say the mammogram that women are recommended to get every other year or every year, depending on whose guidelines you're looking at, that those are supposed to be covered at no copay.
And this is under the Affordable Care Act, Obamacare. And so you're finding what, that that's not the case, or women are going outside the network to get a provider they prefer?
So it could be that this woman went outside of her network and the copay was different. It could be, there are lots of reasons why.
Yeah.
But we're just trying to see what the variation is.
And what is there an explanation? Is there a good explanation for why there would be such a wide range of prices?
In some cases, it may be that hospitals, they tend to have higher prices for things that can be obtained cheaper at, say, a freestanding facility. And a lot of times consumers have no idea that if they just went down the street, they would pay much less. And so this is also a big issue, even for people who are insured, because if you might need, say, an MRI, and that may not be covered, or it may have a different copay on your insurance.
Now, if I were shopping around for open heart surgery, brain surgery, I probably wouldn't want the cheapest or even the second cheapest necessarily, but what is the correlation here between price and quality?
So this is a big issue in American medicine, is there's no correlation between price and quality. And so people think because they're going to the biggest name or the most expensive place that somehow they are getting better care. And that may be true, it may not be true. We just don't have good measures of quality in the system to give people that kind of answer.
And what are you hearing from doctors or other providers about this whole concept of crowdsourcing the price?
So we have heard from doctors and some radiologists, and they're actually really interested in the project. And so we're hoping to partner with them more as the project goes on.
What are they? I would think it would be somewhat threatening, you know, because for most, this is a profit center, potentially.
That's correct. So it's interesting. In some conversations I've had, there is a wariness, but I mean, our message is everyone agrees that this marketplace is broken in terms of how well it can work and how well it can function. And so they're actually interested in working with us to help shine a light on this big issue.
And so you chose mammograms first. Just quickly, what other procedures do you anticipate down the line asking people about?
So we're also going to be asking about back MRIs. We'll be asking about colonoscopy, and then one or more procedures after that.
So fairly common procedures that you could potentially get a lot of people to send you information about.
Yes, common procedures and non-emergency procedures. Because obviously, if you've just been in a car accident, you're not going to be shopping, calling the emergency room, asking what their prices are.
Hopefully not. Lisa Aliferis, KQED Health Editor. Thanks a lot.
Thank you, Scott.
You can share what you paid for your mammogram at kqed.org/pricecheck. You can also search the database to see the range of prices in your area.